We're joined by Edward Lifshitz, Medical Director for Communicable Disease for the New Jersey Department of Health. Dr. Lifshitz, thank you so much.
Thank you. Good morning.
Well, the number of COVID-19 cases have dropped. Yesterday, during the governor's press briefing, he talked about there being 611 new positive tests, and I believe it was 74 new deaths. And my concern is, as we have seen protests across the country, across the state, in light of George Floyd's death, we haven't been seeing social distancing the way we need to see it, at 6 feet apart with masks. It's a concern that everyone seems to have. As I mentioned to folks that I would be interviewing you, that was the number one question that seemed to come up. Will we see a surge in terms of COVID-19 cases in the next few weeks?
That is something that's almost impossible to predict. Yes, obviously, the closer the people get together with the less use of protective measures such as face masks, the more the concern is. And when we talk about protests, they're not all the same. I mean, I've certainly seen protests where people are social distancing, wearing masks and staying relatively far apart, and others where they are congregating closer together and not always wearing masks. As the governor has stated, and certainly a concern for us, is anytime you're having large groups of people get together, there's always the potential for additional spread. On the other side, of course, while from a public health perspective, I would love it if everybody just stayed in their homes for the next month or longer until this thing went away. In the real world, people have to live their lives, and there are important things that people have to do, and whether that be go to work or take care of family or stand up for things that are important, such as in some of these protests that we'll be seeing, you always have to be able to balance off those two different important goals.
As you said, ideally, it would be great if individuals would stay at home, if we could continue with the social distancing, the masks. When it comes to the masks, we've seen that during these protests, some people will take them off, let's say for a few minutes, because they're cheering, they're chanting. My understanding is that they can expel more droplets into the air. Is that correct? And in terms of the masks, how often can people use these masks before they should be throwing them away or possibly washing them? And would they still be effective if in fact they wash them?
In general, if you think about it, it kind of makes sense, the things that we worry about most as far as people spreading infectious virus particles around. The most risky thing is if somebody is actually currently ill. That means they have more virus in their body, and they go ahead and they cough and they sneeze, they're expelling that all over the place. You do some expelling of virus, even just sitting and breathing quietly, but that's not going to go as far or cause as many issues as shouting or singing or those sorts of things, which will tend to expel it further. So certainly that is more of a concern. It's, again, many different things are going on, and it's hard to exactly quantify the risk. People outdoors tend to be at lower risk than people indoors, for example. So if you're outdoors, the risk is certainly going to be lower than if people are congregated into a hall and doing the exact same activities. So all those things play into this. If people are separated by 6 or 10 feet apart, to be absolutely safe. If people are yelling and so forth, again, the risk is very low. As far as the whole thing about masks go, it again kind of depends, and it depends on what you're using it and how you're using it and whether it's getting soiled and other things are going on. Certainly if you're using a cloth mask, the simplest, safest thing to do is every day just take it home and wash it and use a different one the following day.